We care for 238,000 children and families. And with that, we have about 1,900,000 to 1 million visits, encounters a year, about 50,000 surgeries and procedures per year. And we believe you cannot engage in truly excellent pediatric subspecialty care without incorporating research and education into the fabric of that care. We've been really busy. Bringing up a hospital from a greenfield when you don't have a hospital already as a base of operations is an enormously complicated task. Our major investment, the largest single investment that the Nemours Foundation has ever engaged in, will be the health campus here in Central Florida. And this is an aerial view of our site at Lake Nona. I think you heard this morning that this will have an economic impact that may well exceed Disney's impact on the area, and I truly believe that. This is a remarkable accumulation of a core of health tech, and I think this is only the beginning. This is our master site plan, and again, you'd get a great sense of that looking at the model. But this is our inpatient facility here. And what will make this very unique is that we have the inpatient facility here, shared services here, and the integrated attached outpatient clinic there. And so on a floor plate, one would have the inpatient unit, say for instance orthopedics or other surgery, but orthopedics. On that same floor on the outpatient side would be the outpatient clinic for orthopedics. In the middle would be the shared services, physical therapy, occupational therapy, cast room, and the like that can serve back and forth. Now that model has been shown to be quite efficient and very patient-friendly. What will make this hospital unique is that we are employing this model of care throughout the entire building. All floors, all services will have this integrated model of care, outpatient, inpatient, shared services, such that staff can move back and forth, inpatient and outpatient. Families will know their care providers, be comfortable with them, and I think we can provide the superior service with that model. Our timeline is such that we've finished our programming. What do we need? Where are the services going? How much space gets allocated? We are still in the process of looking at what the skin looks like. What are the materials that are going to be in the outside? And so that work's not been completed. It will be completed shortly, and then we'll go into construction drawings. But this is, I think, a reasonable representation of what the hospital will look like. There is mounting evidence that what is done at the design phase, how the design can truly enable the healing of children. For instance, exposure to natural light, bringing nature into the child, reduces pain, reduces length of stay, and we're incorporating those principles into this hospital. It's very nice when you are constrained with a pre-existing structure, you begin to think outside of the routine hospital box as to what can really enable families dealing with this most vulnerable moment in their lives. And what we've done is employ IDEO to look at our processes that families face in getting medical care and telling us what it looks like from their side and how we can do it better. One thing that they've done is they've taken a family, met them at 7 o'clock in the morning, went through their appointment, their process as they go home at night to really understand what families go through, feeding that information back to us so that we can design a truly patient-friendly experience. Healthcare is very complex. Even the transfer of records can be difficult to go from one physician to another physician outside the institution. And we anticipate having a clinical concierge. Families have asked for this to help them navigate the complex healthcare system both within and outside of Nemours, with financial support, records requests, coordinating appointments within and outside the organization. I think this will be, again, just one step that we can take to ease the burden on families. Nemours' forward investment since 1981 has been $677 million. And in Central Florida, it's been $190 million. Our estimated health campus cost will be $400 million. And we anticipate that we'll need to subsidize that to the tune of approximately $40 million a year for at least the first 4 or 5 years. And so a substantial investment. But we are very clear that the best platform for delivering the highest quality of care is an integrated hospital physician practice where there are not competing agendas. This is very important to us as a foundation. We believe it's even more important to delivering the type of outcomes that we've designated as our 2015 goals. What we deliver as healthcare providers is hope. We are dealing with families. We have the privilege of sharing in that family's most vulnerable moment. We deliver hope and peace of mind. We don't forget that. And so with all the tussle about the business of healthcare, putting up a hospital, what we are most attuned is what can we do to provide that family peace of mind. We stand with them.